I mentioned I have a little book club going where we talk about insulin resistance, and trying to bring the discussion to non-exercise activity.
Mm,
And it does come up in this book. It's by an internal medicine physician whose patient base is a South Asian population. We just have very high rates of metabolic syndrome in our
yeah,
community, and I think our dietary traditions tend to be
yeah,
insulinemic as well.
yeah, could be. So,
And the movement context as well, like our relationship to our physical environment, is very different from the one in which this dietary tradition was born in. So,
right.
contributing a lot.
Yeah, yeah. I think that happens in a lot of cultures. You know what I mean? It's like where things have changed very quickly, just culturally, right? Like with technology and how
Mm-hmm.
much you no longer have to be part of your own food making process, and like that. Just that I think has changed more than a lot of habits when it comes to dietary traditions and things like that. So
Yeah.
I mean that's a possible hypothesis for some things that when I was reading the book like the blue zones, it seemed that was a common thread where like some these places where people were living longer, they still had a lot of tie-in to making their own food within their own community, and it didn't matter so much like the what of the food, other than it was just something that they were part of the process in making, which made it more of a whole food, right? Not more processed, but it wasn't like no dairy. It wasn't like, like no carbs. It was just whatever was available, but you were part of the process of making it.
Yeah, and I've read about Ikaria, which I think is one of the blue zones.
Yeah, that was one of them. Yeah.
Yeah, but it's not low carb.
Yeah.
It's got plenty of legumes and lentils, which would otherwise be considered to have like anti-nutrients and
hmm
lectins. But yeah, I think, and we talked about causes and upstream causes versus root causes before.
Yeah.
And but if I were, it is a matter of frame of reference. But if I were to think of the most upstream, at least
hmm
chronologically, root cause or upstream cause I could think of for a lot of our modern suffering is like a divorcement from maybe a this is where it gets, because you mentioned from, I was going to say from nature,
hmm
from, I guess, the environment our genes have adapted to uh, be a part of, is I guess how I'd use
Yeah.
that word.
I think there's something to be said there, but at the same time, like I think it depends on how broad you look at the state of human history, right? Like we just may be still caught in our own evolution to like get used to what's changing, right? So like what we're currently in might just be something where like technology is moving at a certain pace and we're maybe just slow to adapt. But I think like our bodies will adapt to it, or like we'll figure out a way to. But like there's certainly like I don't think we're necessarily worse off now than we were, say, in the past. Like I think that you have to look at it from a perspective: is there a reason that we have made all of this change, from a civilization standpoint? And I think that there is. Like I don't think it's all bad. It's just that we have to be aware of, the downside sometimes of like moving too fast without being able to make other adjustments. Like we might not even realize the adjustments that we need to make until we have data that shows that we need to make them. And I think that's what happens sometimes with like metabolic disease. Like other diseases that used to kill us are not as prevalent, and now it's like we have more data coming in on like, okay, some new metabolic diseases now are a big deal, and what's the issue there? Like we haven't necessarily had enough time to adapt, you know what I mean? And we haven't had enough time to even gather data. So it's certainly popular to discuss all of the nutritional things that we can change, but it's not like it's known. It's like there's still a lot to be discovered yet, and I think that's just to be appreciated. Where it's like an open-ended learning process, and
ultimately, I think you as a individual become your, your best case study for what you should do. And one of the benefits of technology now is that it's easier to monitor yourself. Like it's less expensive to monitor yourself. So it's easier to educate yourself on what to do to help yourself. So I think that becomes where, as like a fitness professional or a healthcare professional, like I think our education has to be geared towards teaching people, educating people, not giving them necessarily like interventions, but just like teaching people how to pay attention to their own patterns and behaviors as their life proceeds, because like things are going to change as your body changes, and maybe even as the environment changes. So like you just want to know how to pay attention in a way, like by monitoring yourself, and know what's sort of important to monitor.
Mm. Yeah. So the movement continuum in that regard is you're clearly laying out a process and things to pay attention to, things that we can attend to better understand our movement, and I guess to be a bit more independent in that.
Yeah, certainly. And then, I think the discussion around like non-exercise activity versus, purposeful exercise activity it's just, I think it's an awareness thing. Like the way I was just trying to like kind of pull from data that I saw, but it also kind of made sense to me in the fact that like, I think our lives can become very compartmentalized, where it's like, okay, yeah, I do my exercise, and I even do a lot of it, like 2 hours a day. But there's not necessarily like a mindfulness involved in it. It's just sort of like checking a box, getting that done. And then the rest of the day is not thinking about like physical movement or, physical well-being. And that seems to not be like a solution to some of the problems that we are trying to solve, like from a metabolic standpoint. And so I think that the non-exercise activity is just, it was categorized within the literature that I saw as like walking, fidgeting, like which probably isn't that meaningful. It's broad categorization, but I think it was a useful thing to put a chapter together on, because there's a lot of things like within a physical therapy world that we are teaching people how to vary their movement while otherwise they would be still, so that they don't create the same stress patterns in the body. So like to mitigate maybe overuse in the body. But I think that ties into even just being aware of like, you want to try to move throughout the course of the day in different ways. And it doesn't really matter which ways. It's just that's just as useful in some ways as having like a purposeful time set aside for exercise. Where I think purposeful exercise really matters is more about like getting better, like having a training process for getting better at more things, not just burning calories, right? So like burning calories would be part of it, but it's almost more of an indirect part of it. So especially if you put it into like the metabolic equation of like trying to lose weight or trying to burn fat, like it's going to be a small part of that. And that's what, I pulled from the literature I saw and put in the book, is that it's actually a very small part of the calories out equation, because there's so many other things involved. But that doesn't mean that like the exercise you do doesn't have an effect on the other things that are a part of that equation, right? So specifically like the basal metabolic rate is probably the biggest thing that will have an effect on us as we age, and there's a lot of genetic factors there. But you have an effect on that to a certain extent by the type of exercise you do, but not necessarily by the calories you're burning within that exercise session. So for instance, like if you're getting stronger, like that, the way to get strong has a very specific type of training regimen to it, which doesn't really optimize calorie burning if you had a heart rate monitor on in that moment. So if you're always chasing calorie burning, then you're missing out on a lot of the things that might spike metabolism, build muscle. But it just, to me, it's like building qualities, right? Like I want to be stronger. I want to be faster. I want to have more endurance. I want to be more versatile. That speaks to like an increased metabolic rate to me. So you think of it as like people that run a lot aren't necessarily thin because they run a lot, because they get better at running, right? Because I've seen, and I think you look at like higher end runners, you're not going to see too many that don't have a certain body type, but it's not because they run a lot, it's because they're good runners, right? Like, so I think and the same thing about like athletes. So you have to practice a lot to get better at something, but you can also just do a lot of exercise and not get any better at something, right? And I think that has to be separated out when you're looking at like what you're trying to get out of exercise.
So are you saying that the runners who are getting more efficient, better practiced as runners, developing adaptations specific to running and improved performance, they are not seeing improvements in like weight loss or metabolism as opposed to somebody who stays inefficient at running?
No, I'm saying that the efficiency of running and the speed and like the improvement in running is usually what makes the body type of the runner more than just the running, right? Like, so like if you contrast a recreational runner versus a higher end runner, you're going to see a different metabolism there. You're going to see like a different ability to kind of work with insulin and different things within your body, but it's not because of the time as much as the improvement. But usually the improvement in the skill that's built there takes time, right? So, but I think like that's not always equated within people's like idea of what they're doing with their more general exercise routine, right? They'll look at the person that's like the best at something and say like, I want to look like that, or I want to be like that. And it's about the process of getting better, which doesn't always have to be super time consuming, but it needs to be directed, right? Like it needs to have a specific intention, and the intention can't always be, I'm just burning calories. Like, so that's where, when you're looking at in the book where I had like the kind of table that separated out, like purposeful exercise, non-exercise activity, like that's looking at purposeful exercise from a calorie burning perspective in the grand scheme of like energy in, energy out, right? Okay. So the biggest part of energy out is basal metabolic rate. So, right. And I tried to explain that in the email, but it basically like that's the way. I'm certainly a fan of exercise, of purposeful exercise, but purposeful really has to mean more than just calories out. It has to be like you're actually trying to improve your options for movement and your attributes that I would think would make you have a better metabolic engine even as you get older, which then takes away from your metabolic engine, right?
Right.
And that gets complex, and that's why it can be useful to have someone who helps you with your movement process. But I don't think it has to be complex forever. It just has to, like once you get an idea of this is what a strength training program looks like, this is what a speed building program looks like, this is what an endurance building program looks like, and that they're all very different. And it's not just kind of like a mix mash of, whatever I like to do. It's really more of like building what you're not so good at and making yourself better at it. But not from a competitive standpoint. It's not like you don't have to prepare for competition. You just want to look at exercise as something like you're trying to build more attributes, because that actually helps the metabolic engine that is the biggest part of that energy out equation.